in 2015, you will not be celebrated. It has been made clear that there is not a corner of VBA leadership that will not cut, nor a statistic that they will not manipulate to lay claim to a hollow victory. What we all want to see, both my Republican and Democrat colleagues on this committee, is progress, not deception.
The Veterans Administration is on the carpet once again, a position they should be getting used to, and rightly so. The latest word from those in charge points to over $200 million being overpaid in disability claims, and the dispute between the VA and Congress over whether any real progress is being made on the tremendous backlog of cases. All this and more people with intimate knowledge of what really went on. They're coming forward and sharing their stories, lending more credence to how stunningly dysfunctional and dangerous the VA has become. Let us welcome to MidPoint. Valerie Riviello is a registered nurse who spent 28 years at the Albany Stratton Medical Center in Virginia, now one of 37 whistleblowers nationwide accusing the VA of retaliation for telling the truth. We are also joined by her attorney, Cheri Cannon, to discuss her case. Ladies, thank you so much for joining us here today.
Hello.
Valerie, let me ask you first with regard to your position. How long were you at the hospital?
I've been there 28 years in March.
Are you still employed there, or are you now currently on some sort of a leave?
I'm employed there. I'm on a special project that I'm to work on 8 hours a day.
But the special project is one that you were put on after you revealed certain things about your tenure and your time there, correct?
Correct.
Tell us a little bit more, if you will, about what you saw, because the stories that caught our attention right away were the words stolen drugs and tortured veterans. Now, that is a headline that has been in certain members of the media, certain parts of the media. The New York Post had that. Tortured veterans is what certainly strikes a lot of people right in the heart.
Well, I was the nurse manager on the inpatient psychiatric unit, and I took a female veteran out of restraints to give her care and basic needs that she required, and that was not what the physicians wanted to do.
When you talk about having this veteran in restraints, you then go into detail as to how the doctor involved, the physician involved, wanted her put back. Can you just talk a little bit about the torture side of this? Because I think if you get a little bit more into this story, people will understand exactly what was happening to this individual.
This individual was a female veteran who had a history of military sexual trauma, and she also has a lot of medical problems, and keeping her in restraints is really contraindicated because of those things, and so the length of time that she was kept in was way more than would have been required, and actually she shouldn't have been put in restraints at all.
What other instances did you see, one or two specifically, that sit with you that I guess the best word would be revolted you, that simply made you question what you were doing at this facility?
The same patient again in February was kept in restraints for 49 continuous hours. Basically what I've seen is a deterioration in patient care, so that it's not patient-centered and it's more physician convenience.
Did you also witness any instances, and can you speak specifically to instances of doctors, medical officials, VA officials, whatever, simply covering themselves, simply making sure that things would not come back to bite them?
I really can't speak to that. I only can speak to what happened on my unit.
Cheri, can you then speak to a little bit more about the legal action that you're involved in here now?
Yes. Valerie first came to a law firm when immediately after she reported the specific instance of patient abuse in November 2013, when it became apparent that she was going to be suffering reprisal for having reported this incident to the patient safety officer. Throughout the month of December and January, we were monitoring the situation. And reported this repeatedly to senior VA officials in New York, that she had been taken out of her job and that she had been a whistleblower. Ultimately, the VA decided to reprimand her for actually treating this patient with the utmost care and taking her out of restraints. We were successful in having that pushed off, but when Valerie vigorously defended herself, and when we defended her, they decided they would suspend her as well. At that point, we had already gone to the Office of Special Counsel, an independent federal agency down here in D.C., and filed a claim with them as well as with the VA IG regarding the patient abuse as well as the reprisal that Valerie was suffering. And as a consequence of going to them, the Office of Special Counsel down here in the D.C. got the VA to stop, or what's called stay, the personnel action so that there was no pending action against Valerie while the investigation is ongoing.
Let me ask with regard to the military speaking to you then, Cheri. Did the military, the VA, anybody, any official at any time intimate or say to you in any way, shape, or form, even a whisper, if you will, that this, what was happening to Valerie now, this reassignment, if you will, was because she went to the media?
It was not because of the media, it was because she went to the patient safety advocate. And no, of course, they're not going to admit that that's why they did it. But the way the legal system works and the way reprisal works is it's very insidious, and people will take actions against other individuals, especially people like Val who speak up for what's right. And they don't ever tell you that's why they're doing it, but in fact, they have no other explanation for what they've done. By moving her out of her job, by trying to reprimand or suspend her, there's absolutely no other explanation other than reprisal for the whistleblowing.
Valerie, after 28 years, why did you decide that now was the time that you had to say something?
Well, in the past, when I said things, there were physicians that actually relied on me and respected my assessments. In the past couple of years, we've had a change in leadership and a definite change in the way patients are being treated, and so I just couldn't remain silent. I needed to speak up for the veterans who sometimes can't speak for themselves, especially in a mental health area, and also for nurses, because nurses' opinions and assessments should not be disregarded.
Are the nurses' opinions, in your opinion then, pretty much turned down at this point to where people say, we know better, shut up, we're the ones who make the decisions?
Yeah, it's kind of a power struggle.
Power struggle from the doctors or from the VA officials?
I would say the physicians and the leadership at the hospital.
Would you say
it's more physician-centered or physician-driven?
So it is many times in your experience that it is the actual physicians who are there, or in many ways playing God, and they simply don't want to hear anything from anybody else?
They just kind of want to do things their way. They don't want to follow policy and procedure, and they don't want a nurse to hold them accountable to that.
What is it that you saw then when you talk about the way the patients were being treated, when you saw a change in how they were being treated? Was there a specific instance, other than the one you've talked about now? How did things change?
Well, we really prided ourselves in a restraint-free environment. In the last 2 years, with a change in physicians, we're now up to 150 hours of restraints annually, when 2 years ago we were down to only 20 hours of restraint annually. That's one thing. Physicians also disregard what patients have to say, and the patients should be part of their treatment and a partner in their treatment.
Why are patients being restrained so much more often now? This almost sounds inhumane.
Basically because the physicians don't want to have to come in during the hours that might not be convenient for them, during weekend or off-tour hours. If patients are taken out and perhaps they have to go back into restraints, the physician has to come in within an hour, and most of the physicians don't want to do that.
So you're saying that the physicians want the patients kept in restraints to make it more convenient for the physicians?
Yes, so that when they can time when they come in to evaluate.
These people that you see being put in restraints, would you say that they needed it?
I think sometimes initially, but we usually try to get patients out within 1 to 2 hours.
There are a lot of discussions now going around about suicides from a lot of these veterans. In your time there, can you say that you saw veterans, people there who were contemplating that you were fearful may do that simply because they weren't getting the help they needed?
Absolutely. Our suicide rate has gone way up. 25% of suicides are veterans. They've tried to have a suicide prevention coordinator and a team of people, but we have lots and lots of veterans who come and have suicidal thoughts, and I've seen a lot of younger veterans coming back that have attempted and or completed.
I have about 30, 40 seconds left here. You have 2 adopted sons in the Marines and the Army. How fearful are you right now for their health once they have to, if they have to get into the VA system? You must be frightened.
I will definitely be overseeing their care, that's for sure. I would hope that they get respectful, dignified care that they deserve. They've come a long way, and they're over there. I have one son in Japan. Another one is here working locally, but their safety is my number one importance.
Yes or no? Do you trust the VA?
Not really.
That's pretty much the answer many people would agree with, I think. Cheri Cannon, Valerie Riviello. Valerie, thank you so much for your bravery in coming forward with this, and we certainly hope that things work out and your sons remain safe. Thank you very much, both of you.
Thank you.
Thank you.
All right, next up, laying down the law on President Obama's continued overreach. That and a whole lot more when MidPoint continues on the Newsmax TV network.